This is my mini hand treatment, and it's my favorite one of the bunch. I show this to anybody who has arthritis, or if you lift weights or do any type of sports where your grip is essential, this is one that you can do every day. Start with your grip assess. Squeeze the ball a few times in one hand and just notice the strength of your grip. And then go to the other side. Remember, you can do the grip assess a couple of times just so you really recognize which side feels like it has a stronger grip. Once you know which side feels stronger, start with your finger compression. Remember, you'll put the tip of the finger and then the pad of the finger on the ball. I want you to do this on each finger 4 or 5 times. Remember, if you have trouble holding the ball with one hand, just put your hand on the ball so that the ball stays still. This is really about mobilizing that upper joint. These are the joints that are actually completely related to your upper neck bones, and when this is decompressed, we actually are releasing our neck as well. Try it on the pinky finger. Remember, this is the one where a lot of people have trouble with, so hold the ball if you need to create that action of the joint. And then your thumb. Take a nice focused breath as you do this. Let's try it on the other side. So a lot of times I do this technique when I'm sitting at my desk, especially when I know I have to work for hours. I always get up every hour just to walk around so that I don't have a lot of stuck stress. And so I want you to think about doing this every day. This one's so quick, it just takes a few minutes. So remember, under each finger, you're just going to 3 to 4 times just create that little flexion and extension with the joint. And remember, if you have trouble holding the ball, just hold it with your fingers because it's all about the action of the joint, not about how well you hold the ball. And then don't forget your thumb, just gentle flexion and extension of that joint. So now let's try our gliding. And gliding here, we could do another type of gliding where you just interlace your hands and create a gentle glide back and forth. I love this one also if I'm going to go lift weights because I don't even need a table or chair to do it. So here's our gentle glide. Remember the secret of a glide, right? You're going to create consistent pressure. It's not about depth. That's going to prepare connective tissue for the shear. Then place the ball right at the base of the thumb pads and you'll create a nice tight rubbing motion. I can focus on one hand at a time. So here I can focus on one thumb, and then I can focus on the other. And remember, the secret of doing shearing is once you create a shear force, compress and wait for a moment. Give the tissue a moment to adapt. Remember, shearing is going to create a local fluid exchange. Take a nice focused breath, and then let it go. Now let's add the knuckle decompress. This is a great one. I'm going to use the small soft ball. So you're going to place the ball in between the 2 knuckles of your index and middle finger. And I want you to squeeze the ball 3 to 4 times. Keep an eye on the back of your hand. You want to see if you can actually create a little recess between the joints. We're actually trying to gape the joints to draw fluids to the fingers. Let's try it in between the next 2 fingers, creating that ball, little squeezing, compression. Now if you feel like the ball is going to pop out between the fingers, watch this. Hold the ball, right? Don't make it a magic act. It's really easy. And again, what we're trying to do is open up the fluid exchange that's going to be created in between the knuckles. So can you see how my knuckle kind of recesses here? That's what we're looking for in your hand as well. Let's try it between the ring finger and the pinky finger. Same thing, creating some nice, gentle squeezing motions. So again, if we have good hydration, we get these tiny recesses. It kind of settles itself in. That's where fluid comes through the hand. So we want to make sure that this stays open and we have no inflammation in these regions of our hands. Now with the thumb, you've got this little piece of flesh. I want you to bring the ball in here, give it a little push, and then squeeze the thumb over and see if you can squeeze the ball. These areas are here that we're trying to create an opening to, right against where the tendons are. Let's try it on the other hand, same thing. So if you have arthritis, this is a great way to bring some fluids back to the fingers. It's really important that we keep our fingers completely full of hydration because when they're not, we really lose the ability to move our hands, and we need them for everything that we do in a day. Let's try it in between the second 2 fingers. Same thing, curling the fingers under and giving it a squeeze. And again, just look at the back of the hands. Ideally, we create those nice little recessions in between the fingers. And let's try it between the ring finger and the pinky finger, curling the fingers under, and same thing, giving it a squeeze. So remember, if you struggle to hold the ball in place, just keep your hands on the ball so that you can create that nice, gentle squeezing. And again, what we're looking for are those nice separations between the knuckles. And then remember, on your thumb pad, you're going to try to go over the top of that fleshy pad. Just set the ball in, fold your thumb over, and give it a couple of squeezes so that we open up some of those little septums where the fluids return to the fingers. So now let's try finger rinsing with the large soft ball. Place one hand down onto the table and begin rinsing your fingers from the base of the finger to the tip of the finger. Nice, easy compression in one direction. And remember, you can go on the top of the fingers or the sides of the fingers. Just don't forget your thumbs. Remember, as you're going over your fingers, you're also going over the wrist of the top hand repeatedly. Nice, consistent pressure. Let's try it on the other hand, same thing. So remember, one direction. Just notice how good it feels to create that rinsing motion. I love the way my hands feel after I do this quick treatment. One more technique is friction. So remember, very lightly in between your hands, just rub the ball to stimulate the lymphatic system and bring some blood flow and new hydration all the way to your skin. This way, just in case you have any inflammation, we can actually have a little bit of the fluids move through the lymphatic system to decrease some inflammation. Take some nice focused breaths. And then let's go back through the grip reassess. Squeeze the ball 3 or 4 times in one hand, and then go over to your other hand. Remember, notice if your grip feels like it's improved. If you're improving your grip, you're not only showing that you're restoring the hydration of your connective tissue, you're helping your autopilot and your nervous system function more efficiently so that you can use your hands for a lifetime.